Hey guys, what's going on? Ian here from Elite Living and Health. We have Dr. Shehata here with us as well, and welcome to the Elite. So we're going to go over today a little bit about preventative and functional medicine, what it actually is. Dr. Shehata is going to give us a 6,000-foot overview on what he feels that preventative and functional medicine is. So this way, we're able to better explain it to you guys, and you guys are able to, get a better understanding of what it is that we do as a practice.
Thank you, Ian, for having me. So preventative and functional medicine to me, as a medical doctor is essentially, focusing on the root cause of a disease process. If a patient is coming in with a complaint, instead of just focusing on what it is that, they're complaining about, let's dig a little bit deeper. Let's see what actually is overall that might be contributing to what's affecting them.
Got it. So it's something, you're almost like, instead of putting a Band-Aid on something, you're trying to find that root cause, and so that you could treat it overall.
Exactly.
Got it. Okay, that makes sense.
So if a patient is coming in, fatigue, maybe low libido, what are the causes, right? Is it just purely from low testosterone levels, let's just say? Is it from poor eating habits, poor sleeping habits? Thyroid as well is another indication to be causing something like that. So it's a multitude of things.
Got it. So, but sort of what it is that we do here, it's not necessarily that someone necessarily, they have a problem. Sort of what you're saying is that there's a way to, I guess, optimize something. So just because you come in and we look at something, that doesn't mean that, oh, your thyroid is bad or your testosterone is bad. It's just sort of, you're not where you once were, or maybe you were never there and you don't know what it feels like to have that more optimal level.
Correct.
Correct?
Exactly. And sometimes even if you're looking at blood work and things, and it might look normal on a panel, it might not be normal for that person. So I think one of the strong points about Elite Living and Health is that we tailor everything for each patient individually, rather than an overall consensus of what the normal is.
Got it. Yeah. So then each individual, they get their own holistic need. So that this way we could treat them as an individual and have them feeling better. So one reason why I started this and why I have amazing doctors like Dr. Shehata here with me is because of the like-mindedness. One thing that I have learned over years and years of, going to doctors just because, or having a checkup or whatever, a lot of the mindset, and I'm not trying to stereotype or put everybody in one box, but I just feel a lot of times if I have an ailment that's going on now, and I go to the doctor, they're going to know exactly how to make me feel better right then. But no one's actually fixing, maybe there's an underlying cause or anything of that nature that they're looking deeper into it, but they have all the answers to fix me and make me better in this very instance. But maybe there's things that could happen to me in the future, and then maybe I don't want them to happen, or maybe something happened to my dad or my mom, and those are some things that I sort of want to try to avoid.
Exactly. I mean, you hit it right on the nail of the head. It's we just take the patient, we have to look at them as a whole. Your mom's side, your dad's side, anything with your siblings, other family relatives. And as you mentioned before, it's not just about putting a Band-Aid, it's the preventative aspect as well. So that we not only treat what exactly is going on in the current time, but to make sure we prevent anything else that can potentially happen as a complication, from any disease processes or ailments that a patient may have.
Got it. Okay. So another thing that I want us to talk about a little bit now that I have you here with me. So although this is one of the many areas that we focus on here at Elite Living, but it does have some type of a stigma on it, and that's hormones, hormone therapy. Testosterone therapy, hormone therapy, everybody puts testosterone in the category of steroids when in fact testosterone is just a sex hormone that men and women both produce along with, estrogen and progesterone, all of our sex hormones, we all have them. Us replacing or optimizing our hormones, whether it's said, testosterone or, estrogen or progesterone or, men and women or going through andropause or menopause or things like that. There always was a stigma to it. And now, common science is saying that a lot of the old cases were wrong. Do you want to explain a little bit further what, optimization of hormones is and how testosterone can help?
Absolutely. I mean, just as you said, testosterone and estrogen are both, vitally crucial for both males and females, both hormones. And actually studies have recently come out to show such a huge decline in, just testosterone alone, especially in young males. And a lot of these, a lot of with the decline now is causing symptoms such as fatigue, irritability, low libido, muscle wasting, just to name a few. And besides that, it also puts patients, at risk for other complications, cardiovascular disease, diabetes, to name a few. So, as we mentioned before, when you look at a blood panel, we have ranges, the low end of the range, the high end of the range, for testosterone, let's say. Sometimes a patient might be in that normal range. However, it's not normal for them. And I think that's one of the benefits and beauties about Elite Living and Health is that we take the patient, we listen to their complaint, and while they might seem in a normal range on paper, they themselves aren't. So what we do is we supplement with the appropriate medications, with the appropriate hormonal replacement therapy to optimize their levels, to make them feel good again.
Got it. So I just want to clarify a little bit because you said something that's interesting, that we're looking to optimize someone, that there's a range, a reference range essentially that falls within the normal. Can you explain that a little bit further? Like what is that normal reference range? When you go to get your labs done, what are those numbers from here to here? What is that normal that most doctors would say that just go home, you fall within a normal?
Yeah, so usually the lower end of the normal is about 300, and usually the higher end is roughly about 1,000. But, like I said before, we have patients that are coming in that fall within 600, 700, and they're saying, hey, I'm feeling weak, I'm feeling tired, I'm gaining a lot of fat even though I'm on an appropriate diet. I just don't have the same intensity, the same drive. So things like that where they look good on paper, but internally they really aren't, and they're not optimized to a level that's more appropriate for them.
All right, so you were saying, just to clarify, that the reference range could be from 300 to 1,000, depending on which lab you go to and things like that, and that someone could have a 700 or 600 or 500 or 400. And basically what he was explaining, just for layman's terms, for people who aren't doctors, so you get a better understanding, is that if you go to your doctor and you ask to test those levels, a normal doctor who isn't comfortable with any of this will say, that's normal, go home. But you could be feeling any symptom under the sun,
Correct.
Tired, lethargy, all those things that you had previously mentioned. So essentially what that could be saying is that maybe, because as we get older, our testosterone declines. So maybe what was happening is that you were always sitting at that 900.
Correct.
You were always sitting at that 900, and now you're, a couple years older and you didn't really realize it, but it's gradually been happening. And now you notice a difference. And because of age, your levels have dropped down to that 600 or 500 or 400.
Correct.
So you're not feeling good because that wasn't your normal.
Absolutely.
So the idea is to just bring you back to your normal. So, a lot of it is you want to be able to treat the symptoms, I would assume, as well as what's on the piece of paper.
Exactly. It's always, the motto I follow as a medical doctor is, treat the patient. Don't just treat the numbers. Yeah. Treat the patient themselves and everything that's going on with them.
Yeah, that's really, really great, because this way you're able to actually improve on someone's life and help with longevity and help in that preventative and functional medicine aspect.
Absolutely.
Awesome. Well, thank you. I appreciate all the
Thank you.
Amazing insight.
Thank you.